Hello, today is Wednesday, November 18th. As of yesterday, there are 85 patients with COVID-19 in our hospital facilities. The number has increased over the past week, and it's at its highest point that we've seen. As our COVID-19 inpatients have increased, we've added 70 more beds to care for these patients. In addition, we have worked on expanding the ICU capacity by using other areas equipped to care for our patients. We have requested outside nursing help and additional nurses from the state to help care for this rise in patients. Looking at the last 7 days ending Friday, November 13th, almost 5,200 people were tested for COVID-19. If you look at the average of the last 4 weeks, this represents a 91% increase over the past week. Also, during the last week, the positivity rate has increased to 24.6%. The number of active cases has more than doubled in the past week. The largest increase appears to be in cases in the age group of 20 to 29 and 30 to 39. We have an amazing team at Shannon, but really our healthcare team is not the front line. We are the last line. The front line is everyone within our community, and we ask for your help to protect one another. Wear a mask, social distance, and please avoid crowds. Drive-through testing is still available at 2 locations, one at the Shannon Clinic North and the other at Urgent Care West. Results are available in 24 hours or less. In addition to COVID, we are seeing more patients with other respiratory illness and viruses that are common during this time of year. Dr. Schultz is going to share more about how our patients may see their provider with our extra safety precautions in place.
Thanks, Shane. You know, we're getting a lot of questions from patients about what's the first thing they should do if they do get sick, start running a fever, or have other symptoms. So really there's multiple options now for patients when they get sick. First of all, if they have a primary care physician, they can call that physician's office and they can tell them what to do, whether they need to come in or be tested for COVID. If you don't have a primary care provider, then of course you could go to any of our 5 urgent care locations, which are open 7 days a week, and the providers there will see you and assess you and see what's cause of the fever and treat you accordingly. Thirdly, you have the Shannon On Demand telemedicine platform that can be used 24/7 to get a doctor's visit online, and of course that's available, as I say, all the time. And then lastly, of course, our ERs are open 24 hours a day, but that's really for severe emergencies like severe respiratory breathing problems or severe chest pain like a heart attack. So those are the options that patients have. Now, when you do show up to any of our locations, there are screeners at the front door who are going to take your temperature, and that's for your safety and for the safety of others in the building. So don't be worried about that. They're not there to screen you out. They may ask you to sit in your car until your room's ready, but that's what that's for there. So Shane, that's some of the options that patients have nowadays when they do get sick. Remember, Shane did say 25% of the patients who were testing are positive for COVID, but to me that means 75% of them don't have COVID and actually have something else wrong with them. So don't be afraid to come in and see the physician.
I want to say thank you to all the healthcare workers in our community for all you're doing to take care of our patients. If you have any questions or looking for information about COVID-19 testing, you can visit shannonhealth.com.